Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the anticholinesterase inhibitors. These anticholinesterase inhibitors can be of two types. One, tertiary amines and quaternary amines. Tertiary amine is physostigmine. So because it is a tertiary amine, it can cross the blood-brain barrier and it will have central action. Whereas the quaternary amines, which include neostigmine, pyridostigmine, edrafodrium, ambononium, so all these will not have no central action. Thank you for watching.
Thank you and thank you for watching.